What life factors will age us the fastest? What beauty product is not worth your money? What are 3 procedures you may regret getting later on? So how do we know that we're going to a safe technician? To stay away from the Groupon. What do you think is the most underrated procedure? The most overrated procedure? Welcome, Dr. Lisa Kellett to Midlife Mix.
Hi. Hello.
So glad you can make it. So you are a dermatologist at DLK on Avenue.
I am.
I love your clinic. I have gone there for several treatments, and I absolutely love going there. And everybody
Thanks.
who works there, the staff is just amazing. And I talk about it to anybody who will listen to me.
Thank you. It's very kind. Thank you.
So I want to talk to you a little bit today about, our skin issues as we age, and get to midlife. What happens to our skin as we hit midlife?
So there are a whole bunch of things that happen concurrently. So you have the skin changes. So you have the thinning of what we call the dermis, which is the deeper layer of the skin. You lose fat as well. And the cells that actually produce collagen and elastin, you see a decrease in density of those cells and activity of those cells, and you see a decrease in number. So those are the things that happen in the skin. You can also get skin changes such as textural changes on the skin. You can get the appearance of brown spots as well, and also, you can get skin cancer as you get older. The other thing that happens is we age not only in our skin, but we also age through fats. We have loss of the fat pads in the face, both the superficial and deep fat pads. And then finally, we actually have bone loss. So you have bone loss around the orbit of the eye, around what we call the maxilla, which is around the mouth. So all of those changes, skin, fat, and bone, occur as you age. And the result of all of that is a loss in volume of the skin. You see more skin laxity, and you see sagging.
So what are the most common concerns the patients come to you with?
So I think one of the most common concerns is volume loss. And volume loss is seen as a decrease in the plumpness of the skin. You see sagging and jowls forming, and also the pigmentation. So the skin, the color changes. It becomes more blotchy, less homogeneous. You have brown spots, sometimes red spots, and skin cancer.
At DLK on Avenue, one of the things I love most about your clinic and the philosophy, whether it's your philosophy or philosophy of the clinic or both, is that you tell patients that they can age their way or age your way. What does that mean to you and the patients that you treat?
I think it actually means, it means different things to different people. So as someone who's been practicing medicine for over 30 years, you get to understand patients significantly better than when I first practiced. And you understand that people want to age on their own terms. So some people are interested in doing multiple procedures and being quite aggressive with their procedures and with the things that they do. And then there are other people who would maybe come to me and say, well, I just want to know how should I take care of my skin? What product should I be using in my skin? And they're not interested in doing any treatments. And both of those, I tell patients, are fine. It really depends on how you want to age and what your concerns are.
I think that's why I love you so much is you don't put that pressure on patients. I've been in 2 different scenarios. Once when I just went with my friend who was getting like Botox or whatever, because that's what friends do. We go and sit and watch each other get Botox. And so I'm just sitting there, just not as a patient or whatever. And she was like asking this dermatologist about like putting filler underneath her eye at the time. And he's like, well, you don't really need that. And then he turned to me, who I was not there to be treated. And then he was like, you need under eye filler. And I was like, fuck off. I'm not even here to see you. Concentrate on her. And then the other day, or about a month ago, I went to another dermatologist for my son because he was like having issues with hair loss. And we were referred to this dermatologist, the doctor. And I was telling him I was going to try this, and we're going to talk about this throughout this interview, is the PRP underneath the eyes. And I asked him about PRP for hair loss, and then he was like, I don't know, he's anti-PRP or whatever. And I said, well, I'm going to try it underneath my eyes. And he's like, well, you're wasting your money. And I'm like, okay, well, what would you suggest? And he's like, have you tried surgery? And I'm like, have you tried to fucking go away? Like, why? Like, I couldn't understand how, with all the technologies we have and like innovations, like, why they would just skip to that. So, this is why I absolutely love you and your clinic is that you feel comfortable going. You know, you're not going to be sold, something that maybe you don't necessarily want, or you don't prey on insecurities.
Well, yeah, and I think from my perspective, as I said, I've been practicing medicine for over 30 years, and I'm also female, and I'm also over 50. So I think all of those things bring a perspective to aging. I think that if people have, for example, precancer response or cancer, then for me, I'm quite strong at convincing people that they need to treat this. This is not something that's elective. However, for elective procedures, I tell patients that my job is to listen to you, to address your concerns, to discuss the treatment options with you, to discuss the risks and benefits and alternatives to treatment. And then at the end of that, if you actually decide after hearing all that information and educating yourself, if you decide that it's something that you don't want to do, I still think that's a good decision because you've made an informed decision based on all the information, and that is still a good decision for you if you've decided not to do anything. So at the end of the day, whether you decide to treat or not treat, as long as you're comfortable with your decision and you made an educated decision, then that is, though both of those options are good options.
Yeah. Yeah, I think that second guy was all of maybe 30, so. I'm like, sit down, little guy. Anyway, before we come and see you, is there anything that women or men, I guess, could do naturally to slow the signs of aging with their skin?
I think that the most important thing as a dermatologist is hands down sun protection. And sun protection, winter, spring, summer, fall, and that means you're protecting anything that's exposed. So in general, I tell my patients to put sunscreen face, neck, chest, backs of your hands year round. That is the most important thing you can do for sun.
So let's talk about new and innovative treatments. What is one of your most favorite treatments you're seeing these days?
I think one of my favorite treatments now is something called the Zafiro. So it's actually for skin tightening. It's non-surgical skin tightening. And I say to patients, there's a whole spectrum of how to treat tightening. So if you want to be tight, if you want to be pulled, if you 100% want to see a 100, like a close to 100% improvement, then you need to do surgery. And if those are your goals and that's what you want, there's nothing that replaces surgery if that's what you want. However, there are many people who say, well, I don't want surgery, but I want to do something. So the non-surgical options in terms of efficacy are between doing nothing and doing a facelift. It's somewhere in the middle. A lot of it does depend. There's an inter-individual variation in terms of how you respond to treatment. But that is a very viable option for a number of people. And the nice thing about the technology, it's basically infrared heat. So it doesn't hurt and there's no downtime. So that's the beauty of that.
Awesome. Can we talk a little bit about one of the treatments that I received there, which was microneedling with RF?
Yes, so there are multiple devices that do that. One is the Potenza, and it is a combination of microneedling and radio frequency. So we know that microneedling causes the induction of collagen, and basically what we do is use small microneedles that break the surface of the skin, and it's very comfortable because you have a topical freezing first. So it almost feels like a little bit of, sometimes it kind of tickles sometimes when it goes over certain areas. So it's very comfortable, and it's just very, very small needles. And what happens is they go into the skin and they cause mount an immune response and get collagen into the area. So it's collagen remodeling. So it stimulates blood flow, it stimulates the production of collagen from cells called fibroblasts, and you get the improvement there. And that is coupled with radio frequency, which is a type of heat in the skin, and that is also another way to cause the remodeling or production of collagen. So both of those technologies are combined each on their own is helpful for producing collagen, but they work synergistically when they're together. And the beauty of it is, you're maybe red for that night, a little bit pink the next day, but the recovery is very quick.
Yes, it was. Um, so I did the 3 recommended treatments. I love the
Mm-hmm.
results. How do I now keep this up?
So as a dermatologist, I always start with sunscreen. I start with good skincare. So optimally should be using a vitamin A topically at night and a vitamin C in the morning. And then in terms of actual, you've done the 3. So in terms of actually going ahead, you might want to do one in 6 months or at a year.
Okay, awesome. Let's talk about Botox because it seems like that's become the norm these days.
Mm-hmm.
Is everybody a good candidate for Botox?
So Botox, so what we talk about now are actually something called neuromodulators. There are many on the market now. Botox is one. Others would be Dysport, Xeomin, and Nuceiva. They are all neuromodulators, and they act by interfering with the communication between the nerve and the muscle. So those would be products that you would use on areas of expressive muscles. So the frown line, the crow's feet, those are classic places. And what they do is they interfere with that communication between the nerve and the muscle and make it, you're unable to, create a frown, for example, or to squeeze your eyes shut. When you inject it into certain muscles, which are muscles that are what we call depressor muscles, you can actually get elevation. So you can have, for example, elevation of the eyebrow as well. So you can get a little bit of an eyebrow lift with it. So there are a number of ways to do it. In terms of candidates, it really depends on the person, and it depends on their facial shape and structure, and also how they express themselves. So some people have a very deep frown. Their frown is very centralized. Other people have a frown that's more lateral. Some people, their frown line doesn't bother them. It might be just their crow's feet that bothers them, or their forehead line. So there is a very much an inter-individual variation on what neuromodulators treat and how they treat patients.
So, for anyone who maybe has hit midlife and has never tried
Mm-hmm.
it, is it too late at that point, or will it make
No, I
will
think
they still
my,
see?
my oldest patient now is 95 that I use neuromodulators in, so that you are not too old. And as I said, it's a very nice drug to use because when you use it, it is not permanent. The effects are not permanent. They last an average of 3 to 5 months. And so if it's something that you want to try, you can go ahead and try it and know that that effect will only last you 3 to 5 months. But then I tell my patients the bad news is it only lasts 3 to 5 months because most people quite enjoy the effects of it.
So when we talk about, because you always hear different things about neuromodules, about whether it's Botox or D-Sport, they say, do you get it again before it wears out, or do you let it wear off and then you get it? Like, what is the
So
best way to do it?
once again, there's a large individual variation. Most of my patients will come just as it starts to wear off, so that they are always looking fresh. I mean, the best thing about, if you want to do, in my humble opinion, in terms of doing aesthetic work, is to make a person look like a fresher version of themselves. And they always look fresh. And I joke to my patients that I can make you look less tired. I can't make you feel less tired, but I can certainly make you look less tired. So the goal is to always be looking fresh. So most of my patients will return as it starts to wear off. They won't wait for it to completely wear off.
And is it something that our body gets accustomed to and it will stop working at some point, or is that another myth?
That's a myth. I have not seen that. There are some very rare cases of antibodies that can develop. I've actually never seen one in 20 years, but it could happen. But I think most of that is actually a myth, or someone who has been to perhaps someone that is not as qualified.
Okay. How do you prevent, I know this is often an issue when you're getting
Mm-hmm.
Botox, is you get the droopy eyes. How do you prevent that from happening?
So the droopy eye can happen. It is rare. but it can happen. I think that the more experienced the injector, the less common that is. So you want to make sure that you go to see one who has a lot of experience and is a specialist.
Okay. Let's talk about something that I'm going to try, which is PRP. Tell me what it
Mm-hmm.
is.
So PRP is basically a part of the blood. It's a platelet-derived part. So what we do is we draw blood, we centrifuge it or spin it, and then we take a certain part of that blood which contains growth factors. And we know that these growth factors have been used in not only in dermatology, but also in orthopedics, for example, in sports medicine. And it's thought that the growth factors can be injected, for example, in the face. They can also be injected into the hair, and they stimulate the production of collagen. They can stimulate hair growth. And some people want to use that instead of using a traditional hyaluronic acid filler. They want to use it, for example, in the tear trough area underneath the eye rather than using a traditional filler.
Yeah, so that's where I'm going to try it underneath my
Mm-hmm.
eyes. What can I expect that day when I come in? I'm a little nervous.
So it's very easy. I always tell patients it's a good idea to drink a little bit of extra water that morning, so it's easier to draw your blood. And so we just draw the blood, we spin it down, and really it's injected. The beauty of that of using PRP is that you can't react to your own blood.
Right.
So for some patients who maybe they're wary of using a hyaluronic acid and they don't want to inject something that's not what we call autologous or from them, then that is a good option for them. The downside with PRP is the results don't last as long.
So how long will they last for?
Usually around the effects last 2 to 3 months.
Okay, so similar to Botox. Does it feel the same as getting Botox?
No, it's completely different because you are injecting something to volumize. When you're using a neuromodulator, there isn't a lot of volume in terms of what's injected. It's more you're using a fluid to, in many ways, to take a powder, dissolve a powder into. So you only need as much fluid as you need to dissolve that powder. Whereas for the use of PRP in aesthetic dermatology, you're actually using that product to fill in an area that is hollow. So you need more volume.
Okay. And you said it lasts about 2 to 3 months.
Correct.
What can I expect afterwards? Like, am I going to be swollen? Am I going to be
You
red?
can have bruising and puffiness. I've had it done, and I find that I do get a little bit of bruising and puffiness with it. So, and I tell patients, if you're doing it on a Friday, you'd be okay to go to the grocery store, but you certainly wouldn't want to go to a wedding or a black tie event that
And how long
weekend.
will that last if I have redness?
Usually you're by Monday, Tuesday, you're fine again.
Okay. And do they do any topical freezing with it, or they just go right in?
No, it's actually quite comfortable because remember it's a liquid, so it's like
Okay.
injecting. It's a liquid it's your own blood, so it's like injecting in an odd way a little bit of blood.
All right. So let's talk about the money because
Mm-hmm.
a lot of these procedures require 2 to 3 treatments to see full
Mm-hmm.
results, maybe with the exception of Botox. But how
Right.
much should we really budget if we want to take our skincare serious? And
Right. So I start with very simple things. Like sometimes it's just a consultation for people. Sometimes I ask them to bring in their skincare and we'll take the time to go over each product and I'll go through what each product does and why it is or isn't helpful for their skin. And sometimes that's all they want. So sometimes they just want a consultation. The next step is to use proper skincare. So to make sure that the products that you're using are efficacious. I always make sure that people are using a sunscreen that is safe and effective, and they go into treatment. So, and then often the treatments, it's the nice thing about doing non-surgical work is it's not all or none. So in surgery, for example, you either cut or you don't cut. There's nothing in between. With what I do, it's nice because I can start with, well, let's start with the simple things, and we can tailor that to your budget, and then it's a journey. So it's not just one treatment. I'll see you as you continue to age, and we can add things in as we go along. So that's the beauty of it, is we can actually tailor the program to not only the patient's clinical needs, but also their budgetary needs.
so, for those who maybe can't afford a treatment at this time,
Mm-hmm.
what products should they have in their medicine cabinet right now?
Right, so it really depends on the type of your skin. So I always say to patients, the most important thing is to sit down with a dermatologist, and a dermatologist will cut through everything and tell you exactly what you need and what you don't need. And it's surprising to most people how little they actually need. You don't need a 20-step skincare routine, for example. You just need to need the perfect products for your skin type, for your skin diagnosis, and also for the protection of your skin. And as I said, it is surprisingly fewer products than most people think.
When we talk about skincare, we often hear about the benefits of medical grade skincare.
Mm-hmm.
Um, when you look at medical grade skincare versus, the stuff we can buy at our local drugstore,
Mm-hmm.
for those who maybe are on a fixed budget, are there any really good drugstore finds that you would recommend?
It really depends. I mean, if you're looking at, it depends on if you have, for example, a history of atopic diathesis, which is asthma, eczema, or hay fever. You're actually better off using products that have less actives in them and are better for your skin that way, and that they won't be as irritating. So it really depends on, as I said, your underlying diagnosis. So it's hard to kind of say a blanket answer because it really depends on the patient and if they have an underlying diagnosis and also what type of skin they have.
Just to go back to the PRP for a second,
Mm-hmm.
because we didn't talk about this part about it, although you did mention it, for treatment for hair loss. Do you
Mm-hmm.
see a lot of both men and women coming in for that treatment?
So it's not great if you're completely bald. It is good if you're thinning. So for example, in women, when they have thinning of the hair, maybe the crown or the frontal scalp, and they have thinning, we have seen some very nice results for women in those areas. If you're completely bald, it's usually not a great option.
Okay. And for women who just have some thinning, is
Mm-hmm.
this another procedure that takes multiple treatments, or is it one and done, or how
Usually,
does it
no.
work?
It's multiple treatment sessions, and often we'll combine that with topicals as well, and sometimes with medication, systemic medication.
Why do we lose our hair as we age, especially for women?
Right. So there are hundreds of causes of hair loss in humans. So one of the ones that we talk about is something called androgenetic alopecia, female pattern, and that happens in females as they get older. And what happens is that the papilla, that the hair changes, the structure of the hair changes and starts to what we call miniaturize and become thinner. And so all of those changes happen as you age, and also it happens really, people think it happens at the level of scalp. It actually happens underneath the skin at the level in the actual hair bulb, which is where the hair is made.
Is there anything we can do naturally to protect our hair from thinning?
It's hard. I mean, the most important thing is remember the skin, the hair, the nails are visible organs of our body that are reflective of our internal health. So the healthier you are, the healthier your diet, the better off you are. And in fact, when people ask me, for example, about supplements, the best way to get your nutrition as humans is actually through diet. So we are actually, from an evolutionary point of view, we are designed to have our vitamins and minerals delivered through food, not through a pill. So the best thing you can do is make sure you're consuming the building blocks of collagen and elastin and hair and skin and nails, and those building blocks would be eating things like green leafy vegetables. Anything that is a dark vegetable in color is very helpful and usually contains lots of minerals and vitamins.
And if we do come to you and let's say get the PRP for hair loss and it
Mm-hmm.
works, how do we upkeep it? How do we keep it?
Right, so continue with having a healthy lifestyle, and often we'll have patients come by at the 6-month mark, perhaps for a treatment, or some people will find that they need a treatment before then. So there's a large inter-individual variation.
Okay, great. So I want to mention some treatments that are, getting popular. You hear about them all the time,
Mm-hmm.
and I want your professional advice, whether it's worth it or skip it.
Right.
So the first one we talked about a lot today, which is PRP.
Worth it in given conditions. Like for example, female pattern alopecia is it can be very helpful for women. So worth it.
What about red light therapy?
It depends. I don't use a lot of it because a lot of red light therapy, for example, the commercial versions of it that you would have at home, have the potency of a light bulb, so they are not efficacious. So I'd skip that.
Is there a good red light therapy one, or like, because you could
There
spend like
is
$200-300 on a mask?
Right there, I would not use the home care ones. They're just not efficacious. We sometimes do use medical grade in the treatment of precancerous lesions, but that would be something at your dermatologist's office.
Microneedling.
Worth it. So I think that it can be very helpful for skin texture and for scars. And you need to make sure though that you're doing the deep version of it. And most of the time you do need topical freezing, and it is done in your dermatologist's office. And for those kind of deeper microneedling sessions, it is worth it.
What about laser treatments?
Laser treatments have a significant role in dermatology, for example, for tattoo removal or pigmented lesions, brown spots, for spider veins, for scars, for rosacea and what we call telangiectasia on the face. So those are all very helpful for those conditions.
Okay, this one is a little bit funny, but I've seen it all over TikTok.
Mm-hmm.
Is putting diaper cream on your face.
So diaper cream, the biggest thing is actually zinc oxide, which is, when I'm older, so when I grew up, people would actually have zinc oxide and put stripes on their nose, for example, when they
Mm-hmm.
went swimming. The commercial formulations back then were not micronized, so they were quite thick. So that is basically just using zinc oxide on the face. So you can do, I mean, it's a great sun protector. It's just so opaque that I don't know how cosmetically acceptable it would be to wear that on a daily basis to work, for example.
Well, people are putting it at night and sleeping on it, or sleeping with it on their face, thinking
It's
it's
zinc
doing something.
oxide, so it actually is it's a type of sunscreen. So I don't know how much sun you're getting as you sleep.
Okay.
It is occlusive. I mean, it has been shown to be helpful sometimes in like some wounds and things like that. So it is helpful for that.
What about like synthetic fillers?
So synthetic fillers, so most of them refer to hyaluronic acid. There are multiple other types on the market. The ones that I would suggest would be hyaluronic acids. I think they're 100% worth it in the right hands with the right injector for the right indication. 100%, they can be incredibly helpful.
And is it true that they just stay there forever and you have to get them removed?
That's not true. So there are types of hyaluronic acid fillers, for example, that actually dissipate over time. And we know that they do intercalate with the tissue. So they are integrated into the tissue. And the ones, for example, that we use in the clinic, they're safe, they're efficacious. They're very helpful for filling in hollows, for improving symmetry and proportion and for volume. And with time, they just basically break down. Now, the interesting thing is that the use of hyaluronic acid fillers, we know, can actually stimulate your own fibroblasts to make your own collagen. So that's actually kind of quite helpful, so that when the actual filler starts to break down and dissipates into your tissues, you actually have more of your native collagen that has been produced.
What about the trend of slugging before bed?
Slugging. Tell me about that.
So I don't know if it's any more than Vaseline, but you see a lot of people on social media where they're just coating their skin, like their face before they go to bed, like with something like Vaseline, and then sleeping with it, thinking that I guess it's going to soak into your skin overnight.
So the issue with that, it can cause perioral dermatitis. It can cause a production of acne cosmetica, which is a type of acne which you get under something that's occlusive. So I would not recommend it. That's a no.
Let's talk about supplements. I know you said we ideally would get everything we need through a diet, but if we're
Hmm.
not, sometimes we turn to supplements. Okay. So what
Right.
about collagen? Like, should we be eating it? Should we be applying it? Is it a skip it or
So
worth
the
it?
the best thing actually when if you want to produce collagen is to actually to get it through your diet. The exception to supplements would be like a vitamin D supplement. We know that that actually can be helpful, especially for those of us who live in northern climates where we get a lot less sun in the winter. We know that vitamin D is helpful, and it has been shown to decrease some of the solid tumor cancers later in life. So I think it's important for that.
So it's worth it.
Yeah, that would be worth it. Yes.
And and is there, because I've seen different kinds of collagen on the market. If you're not getting it through your diet, there's powdered collagen that maybe you put in your yogurt or a drink, or there's pills. Is one better than the other?
So I would actually, I would come back and say, if you're going to go through all that effort, make sure you're actually do it through your diet. You're much better off, doing it through diet and having, a proper diet and a healthy diet. Because the bonus to diet is that not only will you actually make more of your own collagen, but you're getting everything else at the same time. You're getting vitamin C, you're getting vitamin D. So you will actually be healthier if you have a healthier diet, and your skin will look better, not
And
just from a collagen point of view, but also from multiple ways.
what types of foods should we be eating to increase our collagen?
Right. So as I said, fruits, vegetables. Fruits have a lot of vitamin C. Vegetables contain antioxidants as well, which are important. So one of the reasons we say antioxidants is we know that when we have, for example, ultraviolet light damage, it causes the production of free radicals, and free radicals are actually thought to break down DNA. When we break down DNA, you can get the production of cancer, for example. So we know that vitamin C and antioxidants are helpful for mopping up the free radicals. So not only from an aesthetics point of view, but also from a health point of view, they're important.
What about something that I hear about quite frequently these days is beef tallow? Does it do anything
So
for our
there's
skin?
no evidence-based medicine that it is particularly helpful. Remember that our job as scientists, as physicians, is to look at the evidence-based medicine and not something that's a trend. For example, at one point in time, cat urine was a trend, to put cat
What?
urine on your face. So
No.
I always am very cautious when people tell me about trends on TikTok. I say, well, where is that coming from? Who is promoting that? And I think it's especially with social media, it can be very dangerous at promoting things that are not evidence based.
What about biotin for hair loss? Does that help
Biotin
us?
can be helpful for hair loss. I mean, that is one thing if you actually are low, have low levels, that actually can be helpful for hair loss. You also, for hair loss, you want to make sure that you have your thyroid gland tested. So thyroid disease is a common cause of hair loss, as well as iron, low iron. So all of those things should be tested if you do have some hair loss or hair thinning.
So you mentioned cat pee, but
Yes.
what are some of the craziest trends that people have told you about that obviously have no scientific founding?
I think that there was a trend at one point in time called the donut trend, and it would be using an IV and putting an IV underneath the skin of the forehead to expand that space, and then to take your finger and put a hole here so that you would actually create a edematous or swollen donut in the center of your forehead.
Why why would anybody want that?
Well, that's many of these trends. I ask why people would want to do that. That is one of the ones that I would ask why. So it was they just wanted a donut shape on their forehead. Now the good thing is it didn't last. It goes away, right? It's just fluid. And
All
that
right.
fluid just resorb. But that is one of the interesting trends that I have seen. Yes.
How important is retinol as we age?
Retinol is important. I mean, you have to make sure that you, as I said, you see a dermatologist to make sure that retinol is right for you. So retinol can be actually irritating to people, for example, who have rosacea. If they have a history of atopic dermatitis or eczema, it can be quite irritating. So it's not good for everyone. So that's why the most important thing is that, I tell my patients, come in to see me in consultation, bring in all the products that you're using so I can see them, and then we go through them one by one.
And is there a way to start retinol safely if you've not been using it?
There is. I mean, you can start. Remember, retinol is just one type of vitamin A. So vitamin A topically contains, there are probably about 50 or 60 different types of topical vitamin A's. Retinol is one, retinol is one, retinaldehyde is one, tretinoin is one, and the list goes on and on. So it is one type of a vitamin A derivative that can be used on the face, and you have to make sure that you're using the right kind with the right concentration.
Yeah, because I often see there's different percentages on the bottle.
Right, and remember they're different percentages, but they're also different formulations. So, for example, a retinol 1% is much less strong than a tretinoin 0.1%.
Oh,
So you can't just go by the percentages. It's like saying an apple is the same as an orange. They're completely different.
I didn't know
So
that.
you can't say one apple is equal to two oranges or two oranges is equal to one apple. You can't compare them. They're totally different. It's the same thing. Trying to compare concentrations of different vitamin A derivatives.
Oh, interesting. I always just thought the percentage was like higher percentages, like, oh,
No,
I
not
didn't know.
necessarily.
Okay, interesting. Okay, so I'm going to do a quick fire round.
Hmm.
Um, what life factors will age us the fastest?
The sun. Number one, the sun. Number two, smoking. And number three would probably be poor nutrition.
If you had to list, I know you don't have to say a brand name by any means, but like,
Hmm.
what beauty product is not worth your money?
Probably a toner. A
I
toner does
don't
very little.
understand toners.
A toner does very little. So if I was going to drop something, I would probably drop toner.
What are three procedures you may regret getting later on?
Oh, that's a very interesting question. One would be a tattoo. The other would be a piercing. And the third would actually be to have an injectable filler done by someone who is not accredited, who actually sometimes buys their filler off the internet.
Ooh.
So what they're buying is actually not safe for you. And sometimes, for example, there has been a couple of silicone, like industrial grade, building grade silicone injected into people's faces or people's lips or their buttocks. So those are the things that that's the biggest thing, is that you're being injected with an unsafe product from an unsafe technician.
So how do we know that we're going to a safe technician?
I love that question. So the biggest thing is, I would say, here in Canada, is to see either a plastic surgeon or a dermatologist. So if things go wrong, we are the people that fix the things go wrong. So I would see either a plastic surgeon or a dermatologist.
So stay away from the Groupons.
Correct. Yes.
What do you think is the most underrated procedure?
Oh, good question. Skin tightening. I think it's brilliant for so many people. It's a really nice option who, maybe they are looking to tighten their skin, but they don't want a facelift. I think that you will see a huge increase in that, because they are efficacious. They're less expensive than doing a facelift, and they can give a number of people a very nice result. I think another thing now that's underrated is injectable filler. I think it's really gotten a bad rap. And I always say that in the right patient, with the right injector, in the right manner, it's brilliant and can give a great result. And I also say that when a Ferrari drives into a brick wall, it's not the Ferrari's fault. So that's how how I can teach my patients about the importance of seeing the right injector.
A most overrated procedure.
The most overrated procedure would be actually people who I'm not against facials by any means. I mean, if you want to go and relax and have a facial and have a massage and have an exfoliation, I think that's great. But it does not change the structure of skin. It does not, on its own, improve skin laxity. It does not increase collagen or elastin. It just is like a massage. So unless you're actually doing treatments that are evidence-based and we know the science behind them, that they do increase those things, a facial is not going to make you younger.
Good. Well, thank you so much, Dr. Lisa, for taking the time to speak with me.
Thanks.
I
Thank
cannot wait
you.
to see you later this month. And yeah, I'm
Thanks.
going to continue to age my way with the help of you.
Thank you. Have a nice weekend.
You too.